and welcome to my second episode of 21 and 21. This episode has two segments, risk and trust. Models for risk have been around for more than 30 years in healthcare and the life sciences, but trust models are fairly new. My take on risk models is a 10-year history lesson, which started when I was involved in Y2K, aka the 0th year bug in 1999 and 2000 and its remediation for embedded systems in FDA-regulated environments. This started in 1999 and continued to several projects from lab information management systems or LIMS to understand the early electronic prescription or ERX systems till about 2009. The core here is to understand your current systems and map them to the various regulations. Listed here are the core regulations that manage risk and map the gap. I started doodling the core areas of pre-production risk modeling, then the enterprise security landscape for hardware, as well as EPHI or electronic protected health information, and corporate data to their access, their metrics, their contingency planning, and the application space to the user. And full circle to continuous improvement and training. This was in my glass board. Whilst FDA and other regulations are the federal standards in the United States for regulations, NIST, or National Institute of Standards and Technology, and ISO, or the International Standards Organization, are the implementation engines. HL7, or Health Level 7, and OHDSI, or OHDSI, are here since they will be the primary protocol and observational data engines in the future intersection of healthcare and biopharma for real-world data and real-world evidence, or RWD and RWE, in clinical studies and trials. This is a summary of GRC, or governance and regulatory compliance. You could see the 10-year history lesson with regulatory compliance mapping derived from core areas mentioned before, as documented within the various regulations that I encountered, as mentioned before, in one summary view. Yes, it's a little busy, but I incorporated all the legislations and regulations. I will focus today on pre-ops as well as operations, with specific focus on risk and cybersecurity. Prior to starting any systems, software, or data design, understanding risk is critical to GRC. This includes functional risk, or FRA, which includes business risk, and technical risk, or TRA. This process needs to be data and decision driven. A current snapshot assessment of content assets, including physical assets like endpoints with their systems, is a must. If you cannot measure it, you cannot improve it. I wanted to list the cybersecurity components within regulations from about 20 years ago, monitoring logins, to threat identification and remediation, to malware protection, to access control of endpoints, to vendor and enterprise logging and monitoring, to password and key management, to business associate agreements, or BAAs, in healthcare. I guess what was old is new again. Finally, I want to highlight something I used a lot in distributed systems risk assessment, and much more recently using the acronym AIM, or AAAIM, access control, authorization, audits, and identity management. These are the blue dots in the chart here. Ultimately, risk modeling and mitigation is about its implementation and their practice as standard operating procedures, or SOPs. Listed here are 20 mandatory SOPs for the biopharmaceutical industry. Note that 14 are cybersecurity and risk related. I would like to close the risk model summary by something that is taught in medical school and is the foundation of both good physician practice as well as good quality system practice. Say what you're going to do what you said you would do, and measure the difference between what you said and what you did. This is the foundation of trust, which is the next segment. I'll post a link to the trust segment with part of the text. Thank you for watching this segment of this episode 2 on risk. We will continue and see you there in the next segment on trust. Thanks.